Our overall goal for that project is to identify the genes that cause what we call non-syndromic cleft lip and palate. Non-syndromic cleft lip and palate means that there are no other malformations except for cleft lip and palate. The part that goes from your lip all the way up to your nose and behind your lip has not fused properly, and so a gap is left there when the babies are born. It's one of the most common birth defects, and it affects 400 babies in Texas per year, 4,000 in the US, and 135,000 worldwide. This is a significant birth defect because it affects the face. And then the biggest problem is that the kids can have recurrent ear infections and also can have problems with speech because their palate, the inside, the roof of their mouth is abnormally formed. And then to articulate correctly, you have to have an intact palate. So putting that all together, that's pretty significant financial consequences for the families. If you think about that, for all the kids that have this in the United States, 4,000 per year, that's a significant financial burden. The most important thing is we need to figure out what the underlying causes are so that we can avoid these births, and then we would avoid having all the operative issues, the costs, and the pain associated with having repeated surgeries. We know that there are some environmental causes, such as smoking, taking specific medicines, but we also know that there is what we call a genetic liability. And now that we have what's called whole genome sequencing, we can take these multi-generational families, we can sequence them, we can compare their sequences and see what's similar in everyone who's affected compared to the unaffected people in the family and tell the differences. So we're really hopeful that this approach will help us fit the pieces of the puzzle together. We've spent, at least in my lab, more than 2 decades trying to do gene identification, and with all my colleagues throughout the world, we've probably identified about 20% of the genetic liability. At the University of Texas School of Dentistry, we have developed a craniofacial center where we provide genetic counseling for families that have orofacial clefts or any type of craniofacial anomalies. We have researchers working on all aspects of development of the face and the head. They interact, they collaborate, and provide important research discoveries which we are trying to translate into clinical services. Obtaining more funding would allow us to do more sequencing, would allow us to have greater ability to analyze it, and then once we have all that information, we can then bring it back to the clinic to begin testing families to see what their specific risk is and to tell them what could happen in the future. So this is then going to be translational because we can now apply this information in a way to help people prevent the birth defect before it occurs. We're happy to enroll any family where it's just occurred as an isolated case or where it's recurred in families. We want every family. It's an equal opportunity study, and we encourage everybody to give us a call.